Informing effective behaviour change interventions to household air pollution in urban Rwanda. Over half the world's population cook on biomass, resulting in exposure to high levels of household air pollution. People in resource-poor countries have limited choice and access to clean fuels. I want to explore the role of short-term harm reduction interventions to reduce exposure to household air pollution before cleaner fuels become available. Unanticipated consequences of potential interventions are important to understand, so I looked at malaria and household air pollution. Why research malaria and household air pollution? Women have previously reported that smoke produced from biomass deters mosquitoes and therefore reduces the risk of malaria infection. Malaria is seen as a greater risk than the health effects from household air pollution exposure, which reduces the likelihood of moving to practices which produce less smoke. Therefore, this chapter of my thesis aims to explore the potential risk of malaria infection in children under 5 between cleaner fuel transitions, biomass fuel type, cooking location, using the Demographic and Health Survey, DHS. Data was obtained for sub-Saharan African countries and selecting children under 5 years only. Missing data was handled with multiple imputation using the mice package in R, imputing variables which had up to 50% missing. 2 outcome measures of malaria included rapid diagnostic test and microscopy. 3 HAP exposures were investigated: cleaner cooking, type of solid biomass fuel, and cooking location. Multivariable logistic regression was used using the survey package in R, which took into account the complex sampling strategy. Results. Children residing in biomass cooking households had increased odds ratio of malaria infection by 57% compared to those residing in cleaner cooking households. The same effect was seen when comparing wood and charcoal cooking, with children residing in wood cooking households having increased odds of malaria by 77% compared to charcoal cooking. No association was observed when comparing indoor and outdoor cooking. However, when comparing the 2 types of indoor cooking, those children that resided in households that cooked in separate buildings had a decreased odd ratio of malaria by 26% compared to inside the house. This large-scale observational study suggests that practices associated with higher levels of smoke are not associated with reduction in malaria acquisition risk among children living in sub-Saharan Africa. Further mixed method research is required to better understand the relationship between malaria and household air pollution at a household and community level in this world region. Thank you for listening.